So 3 things I would never do as a neurologist and a headache specialist. The first thing would be to ignore a sinus infection. So untreated sinus infections, especially that are chronic for many months, can actually lead to meningitis because the sinuses are really close to the meninges and in the skull. So I've seen a couple cases like this in residency, and it's so sad because it's so preventable. So you might need a CT scan to evaluate your sinuses or antibiotics. So definitely need to see an ENT and be evaluated. So as you can see, this is the ethmoid and sphenoid sinus. This is a side picture of the skull. This is the nose. So if there's a sinus infection going here untreated for a really long time, it can actually erode into the bone here and then lead to the meninges and cause meningitis. The second thing I would never do is let a chiropractor do any high velocity manipulations of my neck. So there are 2 really important arteries here called the vertebral arteries. So any high velocity manipulation can actually tear them, causing a dissection, which actually can lead to a stroke. As you can see, this is the vertebral artery here. This is a picture of the side of the neck. This is the high degree manipulation, and then it's really susceptible to injury right here. So as soon as you turn, it could tear, leading to a stroke. So the third thing I would never do as a neurologist is ignore a really, really bad headache. A 10 out of 10 headache, a thunderclap headache, the worst headache of your life. You need to be evaluated because it could be a sign you're having an aneurysm rupture or a bleed. So yeah, hope this helps.